Hi, I am so elated to meet you in the program of 1 minute please. What are the differential diagnosis of red color urine? If someone passes red color urine, it invokes three important differential diagnoses. One, it may be food and drug induced. Second, it may be due to hematuria. And third, it may be due to hemoglobinuria or myoglobinuria. How can you differentiate all the three? If that urine is subject to complete urine examination, this complete urine examination is able to differentiate to some extent. You are all aware that complete urine examination comprises of three parts. One, macroscopic examination, and second one, microscopic examination, and third one, dipstick method. So, of course, through macroscopic examination, you are able to say that patient has passed urine which is red in color. When this urine is subject to dipstick test, then if dipstick test reveals blood, please remember that if dipstick test reveals blood, then you can of course rule out food or drug induced. Then if blood is revealed by means of dipstick test, or if dipstick test reveals that blood is positive, then what would be the differential diagnosis? Then two important differential diagnoses have been left out. One is hematuria or hemoglobinuria and myoglobinuria. Then when this urine is examined under microscopic examination, if microscopic examination reveals presence of RBCs, then it indicates hematuria. Because in hemoglobinuria and myoglobinuria, there won't be any RBCs, because in hemoglobinuria, RBCs are of course lysed. So, if urine microscopic examination reveals that RBCs are present, then it is true hematuria. So, when blood is positive with dipstick test and RBCs are present, then it is hematuria. When dipstick test reveals there is blood but there is no RBC, then you can't be content with that simple absence of hematuria, then you have to think more than that. Then it may be due to hemoglobinuria or myoglobinuria. Hemoglobinuria may be secondary to hemolysis, or myoglobinuria secondary to muscle injury thanks to rhabdomyolysis and or drug or toxin induced, and so on. So this is the way we will always try to differentiate. So when urine is subject to urine examination, if blood is negative, then probably you can rule out food and drug induced. When it comes to food, think of blackberries and beets. When it comes to drug, think of pyridium. Of course, rifampicin can produce orange color urine, but that won't be a true red color urine. So I would like to conclude in such a way that if you find blood in the urine, I think that the food and drug cause can be ruled out. Then once blood is positive, then look for RBCs with microscopic examination. If RBCs are present, then it is true hematuria. RBCs are negative, think of hemoglobinuria and myoglobinuria. Thank you.